In health news, it's being hailed as a revolutionary procedure for glaucoma patients.
And now it's available here. News 8 medical reporter Jocelyn Menta is here to tell us all about it. Jocelyn.
And Keith, it is pretty amazing. Doctors are using a very small stent, smaller than the date that's on the penny, implanting it with big results for patients dealing with an eye disease that can lead to loss of vision.
Here's the little stent going. I'm placing it inside the eye now.
Move in closer to your television screen so you can see the tiny stent changing the lives of glaucoma patients.
The problem in glaucoma patients is their drain, which is this meshwork, is either clogged or not pumping well enough, and the pressure builds up.
The stent frees up the fluid buildup, lowering the eye pressure.
The problem is with the fluid or the pressure is that if it's too high for that nerve, that eye's nerve, the nerve basically gets squished or compromised and slowly starts to die off.
Dr. Robert Noecker is a glaucoma specialist at the Ophthalmic Consultants of Connecticut, the first to offer eye stent in New England. He says the revolutionary procedure is a game changer in treating glaucoma, which left untreated can lead to blindness.
It's like a little periscope. There's a part that goes into the drainage and wall of the eye, and then there's this little spout, which is what the fluid exits the eye through.
Anita Schock had her right eye done 3 weeks ago.
It's a little blurry still, you know, and a little scratchy sometimes, but it's getting better, I think.
Okay, we're gonna go straight into this room here.
She's heading into the operating room to get her left eye done.
I could not see at night. I didn't drive at night. The glare was very bad.
The eye stent is for patients with mild to moderate glaucoma like Anita.
Minimal anesthesia, the patient walks in, walks out. Their eyes, they can use their eyes right away. Their vision's not all blurred up.
In the operating room.
And it's in very good position, and it's now fluid will start leaving the eye that way and therefore lower the eye pressure. Our goal is to get her off of eye drops, you know, certainly for the near term, but hopefully this will be the last treatment that she needs for glaucoma.
I'm perfect.
Now Anita is focused at living life.
Already newer versions of the eye stent are in clinical trials. Dr. Noecker tells me patients with severe cases of glaucoma could benefit. For more information, log on to WTNH.com.